Well, most senators on both sides of the aisle and the public getting a first look at this 142-page document today after it was written behind closed doors. Now, we've been reading through this today, and here are some of the key points. The Senate GOP bill does away with the individual mandate, which requires most Americans to buy insurance or pay a fine. The Republicans also want to set caps on federal funding for Medicaid, putting more of a burden on states. Here in Indiana, we've got approximately 1.4 million people on Medicaid, including kids and people with disabilities. Unlike the House version of the bill, the GOP Senate bill keeps protections for people with pre-existing conditions, but insurers are no longer required to cover the 10 essential health benefits, which include things like inpatient hospital care, prescription drug coverage, and childbirth. Plus, the bill would repeal several taxes for high-income Americans and defund Planned Parenthood for a year.
It's been tucked behind closed doors. And on top of that, they want to have a vote next week. We've not talked to a single patient. We've not talked to a single doctor. We've not talked to a single hospital.
I want to get to yes. My hope is that this can be a down payment on the promises so many of us have made for some period of time to Hoosiers. That is that we need to change our nation's health care law.
A vote on this bill is expected next week, so just a few days for senators to decide which way they're going to go on this important piece of legislation. This afternoon, 4 GOP senators saying they are not ready to vote for this health care bill. Republicans can only afford to lose 2 votes to get this passed. In the studio tonight, I'm Gabby Gonzalez, CBS 4 News.